All right, everyone, I'm right at the top of that hour, so we will go ahead and get started. It truly is a pleasure to be with you all today. I see many folks have joined, and we welcome you all. And we just want to highlight today's session. We'll be talking about measuring and strengthening employee engagement. And so if you'll follow suit and just use that chat feature just to let us know who you are, your name, your title, and your organization, that would be ever so helpful. And we can move to the next screen, Caleb. Yeah. So this is our funding statement. We acknowledge this before every webinar that we do and every educational event that we do. We are funded by the Delta Regional Authority in collaboration with the Federal Office of Rural Health Policy. And I'd like to, again, welcome you all, introduce myself. I'm Kim Mayo. I'm a program specialist with the Telehealth Outreach and Education team here at the National Rural Health Center, working on the Delta Region Community Health Systems Development Program. And we are recording today's presentation. We'll get that posted to our website and send notification out when that's ready to be viewed. We would love to see your face if you have that ability and capability. If you are dialing in, and we'd love to hear from you as well. So if you're able to unmute when there's an opportunity for dialogue or for questions, or if you've dialed in, you can press *6 to unmute the line. And we use that chat box as well for any questions or comments that are out the presentation. All right, and yeah, the purpose of why we're here, what we're doing. So the center is a nonprofit organization dedicated to improving health in rural communities. The center provides technical assistance, tools, and resources to support rural providers in the 5 core areas you see listed on your screen. And the next slide, it talks about our commitment to diversity, education, equity, inclusion, and anti-racism. And you can find more resources on our website that really show our commitment to this. And it truly is my pleasure to introduce to you today Shannon Studden. Shannon is an independent leadership consultant specializing in employee engagement, conflict management, work team development, and emotional intelligence. In her role, she provides education, coaching, and technical assistance designed to help leaders achieve their goals. With over 20 years experience providing education and coaching to leaders in such fields as rural health, mining, and public utilities, Shannon uses a personalized, practical approach focused on measurable outcomes. She has a Master of Science degree in Industrial Organizational Psychology from the University of Tennessee at Chattanooga. So we'll start some pre-polling questions and let Shannon, and we'll pull those up. So we have a few questions for you too before we get started that we just want to know your understanding of the impact of employee engagement that has on your organization's patient outcomes and bottom line. And then we'd like to have a better know your understanding of the DRCHSD's programs, our employee assistance assessment process. So if you'll fill out those, get those completed, and I'll let Shannon kick things off. Thanks so much for being here.
Thanks, Kim, and thanks everybody. It's nice to see faces and names, some familiar and some new. So this is the plan for this session. We'll talk first a little about what employee engagement is and why we care about it, how the employee engagement assessment fits into the 3-year Delta program. So kind of how it fits into all the moving pieces that come as a participant in the Delta program. We'll talk about the assessment process itself, and then we are fortunate enough to have Dr. Marcia Pugh here from Greene County Health System, who it has gone through the year 1 assessment with her facility, and we just invited her to share her experience with you. Dr. Pugh is chock full of wisdom and great advice, so we're just so happy to have you here. much view. And then we'll have some time for questions and just a closing discussion. I was looking at the names of people who are here, and I see we have some people who have gone through a couple of engagement assessments. So for those of you who have not yet gone through one, we might have some additional people who can provide some perspective on what it's like and give their advice. So that's the plan. And Caleb, if we can go to the next slide. So just a little bit about engagement itself. So at the center, we define engagement as the extent to which employees are passionate about their work and committed to the organization. And if you click, Caleb, this is a little bit of what it looks like, just sort of a snapshot of when employees are engaged, what does it look like? So there's generally a sense of a positive vibe and energy. It doesn't mean everybody is always happy all the time, but just overall a positive place to be and a positive feeling about the work environment. People who are engaged tend to stay more focused amid all of the distractions. And we know there are always distractions in the workplace, but there have been an exceptional amount of distractions in the last several years with all the things that we have going on in our environment. So people who are more engaged tend to be able to stay more focused on priorities amid all those distractions, and tend to stay more persistent in the face of challenges. So when hurdles and roadblocks get in the way, people who are engaged feel more comfortable and more willing to stick with the challenges. Employees who are more engaged tend to take action, just spring into action when needed, but rather than waiting to be asked. They're willing to step outside of their job description and their formal role to help other people, whether it's patients or coworkers or people in the community. Engaged employees tend to more readily adapt and respond to changes, both inside the hospital or clinic and outside, and tend to engage in behaviors that are more aligned with the strategic goals of the organization. So it kind of related to that focus amid distractions. We know what's important to us as an organization, and that's then going to drive my behavior and my decisions at work. That's how that helps me prioritize. And go to the next slide. Higher engagement leads to all these good things. So over on the left are sort of these intermediary things. So when we're more engaged, we tend to have a greater sense of meaning and purpose in our work. We tend to engage in more discretionary effort, which is related to some of the things I talked about on the slide we just saw, but more willing to step up, do things outside my normal scope of work, and engage in things that I don't necessarily have to do, but want to do because I feel really invested in the organization and in my job. Leads to increased retention rates. There's a very strong relationship between engagement and retention rates. And when the organization has a reputation in the community for having engaged employees and being a positive place to work, that gives hospitals and clinics a huge leg up when it comes to recruitment. People want to work for you. All of that then leads to these kind of bottom line results. So when we've got higher employee engagement, it tends to result in higher clinical safety and quality scores, higher HCAP scores, lower per patient spending per readmission, higher net margins, and ultimately stronger financial performance. So all of these things, the things that start with just finding meaning in your work and having good relationships, there's a really clear line all the way down to the bottom line of the organization and long-term sustainability of it. And go to the next one, Caleb. So the question is, how do we get there? I'll go back. Next slide. Oh, shoot. Can you click again, Caleb? Got some messed up animations on the slide. Click it all the way through. Thank you. So this is, you may have seen this slide before. This is the multitude of things that happen as a participant in the Delta program. So there are all these things related to community partners and financial things, and we've got this multitude of activities and assessments and analyses and planning that gets done. And the way that the engagement assessment fits in here is in red on this slide. So in the first year, we measure engagement in your organization, then take that intervening year to really put in some interventions and some practice and maybe some skill and knowledge development for leaders to support the changes that your hospital's leadership team has decided are most important to you. And then measure again in year 3. So it does take a lot of time. It takes time just to get the engagement assessment going, really understand the results, decide what you want to do about it, put everything into practice, have that kind of take hold in the organization. So we have that intervening year for all of that. And then in year 3, assess to see how much the needle was moved in the things that you decided were important. There is an option to do the assessment and have an intervening assessment in year 2. Some hospitals opt to do that and some do not, but that's available to you if that's something that you want to do. I'll go to the next slide. So the question is, what does taking action look like? So sometimes what comes out of an engagement assessment are interventions that are kind of at an organizational level. It might be policy. It might be just changing practices, culture change. So things like if results come back that it looks like people really have concerns about salary and benefits, it might be doing a compensation survey to do some benchmarking and figuring out where your organization lands as compared to peer organizations as far as compensation goes. Sometimes there's only so much you can do with compensation, and so sometimes the decision is made rather than we can't make any changes to compensation, but we get the understanding that employees really don't have the full picture of their total rewards package. So all of the elements of compensation that may not be as obvious to them, they may not show up in their paycheck. So things like vacation and what the organization pays for employees, healthcare, that kind of stuff. So sometimes it's more about communicating what the full package is rather than changing the compensation practices. Sometimes it's just about communication organization-wide. Sometimes the decision is made to create an employee advisory council to have a really standard, well laid out plan to have an intervening a little intervening group be the conduit between the employee, the entire workforce, and the senior leadership team. And sometimes it's just big. It's a really big initiative focused on aligning culture to support long-term goals. So, for example, if one of the long-term goals of the organization is to become more collaborative, so to kind of break down boundaries internally and externally, so really to be working hand in hand with community partners, but the culture is more focused on individual achievement and people are rewarded and recognized for their own work. That's a little bit of a misalignment between the culture of the organization and where they want to be. So that's not something that can be done on a small scale. That's a big scale cultural initiative, and that sometimes that comes out of these assessments. The next one, more often though, taking action involves developing leaders, because we know that an employee's immediate supervisor has far and away the biggest impact on an engagement of their teams. In fact, there was I read not long ago, a Gallup study that found that over 70% of the variation in engagement scores is directly attributed to employees' direct managers. So a huge impact. And so if we can just support leaders and help them build their knowledge and skills and their practices to support engagement, that can really make a difference. So one of the primary goals of the Delta program is just to identify opportunities to strengthen knowledge and skills of employees, or of leaders, sorry. And these are some of the topics that come up the most often. Collaborative leadership is a really big one. How do you make decisions as groups? How do you build trust within your team and with your peers to become a more collaborative organization? You can see things on here like delegation and empowerment and feedback and managing conflict. Employee rounding. Buddy to boss is a really big one. That's really about people who have started as a technical expert. So they may be a lab tech or a nurse or an accounts payable person, and they get moved into a leadership role. That requires a completely different set of skills. And so just helping people kind of manage that steep learning curve and help them see themselves as a leader and build those leadership skills can really make a big difference. Next slide. So we can talk about just the assessment itself. I'll share a couple more things and then I will turn things over to Marcia, who can bring some of this more to life. So let's talk a little about the assessment. So this is a little snapshot of the SurveyMonkey assessment itself. Go to the next one. Here is the framework that the assessment is built on. So it's an evidence-based employee engagement framework that's supported by decades of research and comes along with some evidence-based actions that can come out of the results. So if you've got low scores here are some things we know can make a difference in that. So just to go quickly through the framework. So starting at the bottom, we've got satisfaction with salary and benefits. That does not in and of itself create engagement, but it's kind of the baseline cost of entry, if you will. So that salary and benefits do not in and of themselves create an engaged workforce, but they're necessary in order to get to some of the higher order elements related to engagement. So then going up to the next level, we've got capacity to engage, which is really about resources. So do employees feel they have the resources that they need to engage? Do they have the equipment that they need? Do they have the time that they need? Do they have the financial support? Do they have the social support? All of the resources kind of get packaged into capacity to engage. Then we've got motivation to engage, which is about finding meaning in my work. Is the work that I do connected to my own personal values? Do I see the impact that I have on other people and the world around me? And is that something that's important to me? We've got freedom to engage. So does it feel safe and worthwhile to engage? Can I ask questions? Can I offer suggestions? Is that welcomed? In some organizations, it isn't, and that really impacts engagement overall. And then strategic engagement. So all of this can be in place, but if the things that I'm doing are not aligned with the goals and the mission of the organization, it's all for naught. So are my efforts aligned with organizational goals, which really starts with understanding those. Do I know what the strategic plan is of my organization? Do I know the mission? Do I know the priorities? And that's sort of the starting point for aligning my behaviors, my decisions, my actions with the goals of the organization. So this is the framework that our assessment is structured around. And when we report the results, it's organized according to these categories. And the associated recommendations that come out of that are also organized by category. The next one. So this is the process. The whole process is very collaborative. Our philosophy is that you, as leaders of the organization, know your culture and your people the best. And we see our role as being those who administer the survey, share the results, help you interpret the results, and then facilitate the process of you and your team identifying what next steps would have the greatest impact on your organization. So we provide the information, we provide some options, and then just help you sort through what's most meaningful to you. So in the planning process, we work with you to establish the timeline, agree on the process, finalize the questions. We have a lot of standardized questions, but have the opportunity to add some. Some hospitals have done engagement assessments in the past and want to add a couple of questions that they've included before so that they can measure that over time. And some just there may be some initiative going on that they want to get some feedback on. We set up the survey in SurveyMonkey and then send a link that can be shared with employees. And we assure employees, and we work very hard to make a priority to keep all responses anonymous. Patricia, I see you have your hand raised. Do you have something to add? So Patricia is the workforce and leadership coordinator, and she's the go-to for engagement assessments on the Delta team. Go ahead, Patricia.
Hi, good day. During the EEA window, we often have hospitals that ask, how can they encourage participation? Can you touch on that a little bit when you have a chance?
I sure can.
Thank you.
Do you have anything you want to say about it before I do?
I would love to hear your comments about how much encouragement might change the results or not change them.
Okay. All right.
And legitimate ways to encourage and in ways that really don't work very well or aren't super great.
we actually have someone here in the call. I don't know if he's still here, who had probably the best idea we've had in the Delta program for encouraging participation, and that was that Steve, I don't know if you're here, Steve Potler, that if their hospital got to a certain level of response rate, that there would be an ice cream party, and they hit it out of the park. So that was a great way to encourage participation. What doesn't work, so kind of those whole organization, if we as a group get to this, you know, there will be everybody will benefit, can be really helpful. Also, just reiterating how important it is and how much people's input is valued and will be taken into account, and then followed up on. So sometimes we have hospitals who have a little bit lower response rate in the first year because people aren't quite sure if it's worth the time and the effort. But what gets done in that first year really dictates what the response rate is the next time. So we see a really big increase between year 1 and year 3, usually, because most hospitals are really, really intentional about following up and communicating with people. Here are some highlights of the results. Here's what we're going to do about it, and then actually following through and doing that. But we don't encourage anything that would make it seem like individual people are being singled out. We know you haven't answered, and we want you to answer. So it really needs to be all together, kind of a collaborative process, that if we do this, here's how we'll all benefit. And Angela, so you do the same thing. Angela, would you want to unmute yourself and tell a little bit about how you've done that? I don't want to put you on the spot.
Hello, sorry, I was in the middle of doing something else. I was listening.
Oh, sorry.
We actually just finished ours. We do a quarterly engagement because we're part of the CHRSD system, that we're managed by the CHRSD system. And so they require a quarterly engagement, and ours averages between 75 to 84% for employee engagement. We recently just bought a popcorn machine, so we're going to switch from ice cream to popcorn the next time. But it's just, we're a small hospital, of course, so it really engages people. We've started putting the QR code so they can just scan it on their phone and do their assessment right there.
Love it. Love it. It's amazing how those treats can just generate some fun and some enthusiasm about it.
Yeah, and employees that normally don't get to see each other, when they come to that social event, they get to visit with each other, which is nice.
Love that. Yeah, so it's more about just the eating of the ice cream, but let's get together and have some fun. Love it. Thanks, Angela. Steve, I see you have your hand raised.
Yeah, I was just going to comment that in addition to the things that you said there, we also have a daily huddle among department managers, and we report out, and we expect the managers to distribute that report out, and our HR leader would report out our progress towards getting the ice cream party. So it was something that people were getting a regular reminder of how close we were to getting the prize. And so it kind of starts that horse race, that chase phenomenon of I can get there, as opposed to being something they heard about at the beginning of it and then only at the end when they either got it or didn't.
Thank you.
Love it.
Okay.
All right. So you see there are some really effective ways, generally involving ice cream and popcorn, but also just having fun with it, keeping people up to date on how things are going so we can see progress. There's a lot of great ways to do that. And if when you engage in your first engagement assessment, you want some other ideas, Patricia can absolutely help with that, and so can I. So the window for the engagement assessment in the middle stage of the process is usually about 2 weeks. Sometimes we expand it to 3 weeks, just depending. Sometimes in summer months, hospitals like to have it open a little bit longer to accommodate for vacation. And then Patricia sends response rate updates every week so that you can see how you're doing. And sometimes if the response rate is lower than expected, the decision will just be made to keep it open a little bit more and do one more communication, one more push to see if we can get some more responses. Then Caleb, if you go to the next slide, I'll talk about what happens after. So afterwards, we crunch the data. So we've got Lauren Prinya on the Delta team at the center, who is a data whiz. So she crunches the data and creates a really detailed report of the results, including some recommendations. And you can see here's some snapshots up on the screen. So we've got the summary statistics. There are results by category. So that 5 category framework I showed earlier, results, the individual questions that make up each of those categories. You see the averages of, obviously, average responses to all of the questions, and then some accompanying recommendations, again, supported by the model that this assessment is based on. Send that out to you as the hospital leadership team to give you some time to absorb it. There's a lot there. So because there's a lot there, we want to help you sort through it. So we lead then a review call with you and your team to talk through highlights of the results, answer questions that you might have, and facilitate a conversation among your team about what's most important to you and what you want to do next. And then the beauty of the Delta program is then the Delta program provides the resources to help you do that. We can go to the next slide. So here, this is just cohort 19, who is just now beginning their year 3 assessments. We have only a handful of hospitals in cohort 2019 that have done their year 3 assessment, but so far, here are the results. So you can see that the average score, this is a 1 to 5 scale, the average rating in year 1 for these hospitals was 3.77. It has increased by year 3 to 3.91. That might not look like a huge jump, but when you consider that this was exactly during the pandemic, so basically year 1 was 2020 and year 3 is 2022, and hospitals across the country overall, most hospitals experienced reduced engagement over the same time period. So that really says a lot about the hospitals in this program and all of the incredible work that they did to not only stay stable, but to increase engagement over this incredibly difficult time in the healthcare industry. And then we were talking about response rate. So you can see what's happened to the response rate. So in year 1, the average response rate was about 61%. In year 3, that has gone up to almost 80%. So a significant jump in response rate. And as I said earlier, I think influenced in a great deal by what people saw come out of the year 1 assessment and all the great communication and the interventions and the work that were done in the meantime. All right, so enough from me. Let's hear from Dr. Pugh. Dr. Pugh, would you be willing just to share a little bit about your experience with the engagement assessment overall?
Sure. Good morning, everybody. Greene County Hospital is located in a small rural area. It is a population of about 9,000. It's in the western section of Alabama, and it's just kind of special. I came here in December of 17, and I've learned a lot about the staff and the people here. So when we were talking about engagement, it was something I really wanted to do. And not just me, but I had previously talked to other staff members about doing this, and it just kind of got pushed back on the burner. You know, you have so many things going on and you have so much stuff to do until, even though you know you need to do it and you want to do it, it ends up getting pushed back. So DRCHSD gave us a great opportunity to do what we really wanted to do and had been planning to do, you know, for some time. We talked to them about the pros and cons. You know, yes, it's great to do it, but what if we don't get what we want? That was one of the things I had to get the management to understand. You know, we want the great and the fantastic, but we want the bad and the ugly too. And that's something that you just have to accept. Everybody's not going to like it. Everybody doesn't work here to enjoy and have a good place to work and like their peers. Some people come, want to do their job and go home. So just getting everybody on the same page, getting the DRCHSD staff to understand this is where we are, but we feel like we can do better and we can move forward. And this would help us do that. We talked about what we wanted to know, looked at the questions they had. And we also talked about whether we wanted paper versus electronic. And I know a lot of people, go the electronic route, but as we talked, as managers talked, we also kind of went back and talked to staff. Not that we're going to do a survey and we want to know how you want to do it. Do you have a computer at home? Do you have a smartphone? Do you use it? We kind of observe different things. And we found a lot of people without computers. We have some older employees that don't have a smartphone, don't know what the internet is. They only use Facebook and that's it. So we decided to go the paper route. Sounds like it would have been a lot of work, but I feel like we mastered our process. And we did some things that were kind of unique. We bought a clear plexiglass box with a lock. The key was kept by one individual person in administration. Wasn't me. So I couldn't get to anything that was in the box. The staff was allowed to come into the boardroom where the surveys were kept, complete their survey, put it in the box, and they could see that it actually went in the box, how it was located in the box. Anybody could come in and look at the box that wanted to. They could take a picture and see that nothing's been taken out, nothing's been added to. People, night shift and evening shift that didn't come before we would lock up and go home were given surveys in a manila envelope. Their name was attached on a sticky or with gem clip. So they could take their name off, put the survey in the envelope and actually seal it and put it in the box for their manager, who brought it up the next day. So believe it or not, we ended up with about a 48% response rate doing it like that. We wanted the staff to believe that it truly is anonymous, that although it's in administration, it has to be behind locked doors. We're not taking anything out. We're not adding anything to it. It is truly going to be your survey. I routinely make rounds every morning. And the survey made me realize that I was only hitting about a third of my people. So I make rounds in the morning. I make rounds in the evening to catch 3 to 11 shift. And I come in early to make rounds on night shift about once or twice a week. So the survey not only helped others, but it also helped me. When we got ready to package up our survey results, we had a team. We had me, we had the CFO, we had the quality director, and we have union here. We had the union steward to come in. So there were 4 people that actually was the team. Anybody that wanted to come could come and view us as we took them out of the acrylic box and packaged everything up. Once everything was packaged, the 4 team members put their initials, one on each corner of the package, to show this is what we saw, this is what we got, and this is what is being mailed. I let DRCHSD know what we had done, which they thought was interesting. So, did you get a package from us and did it have initials on 4 corners? They said, yes, we did. We said, awesome, that's what we sent. So with that, even after that, I had people coming, well, I didn't realize it was, gonna be like that. And y'all didn't put anything in. And next time I'm gonna do a survey. I didn't know whether they'd done a survey or not, but it really made a difference in just bringing the staff together. We have a nursing home here. a hospital, and a rural health clinic all on one campus. And the nursing home staff, nursing assistants, the EVS staff, nutritional services staff, and plant operations or maintenance staff are the ones that are union. And that's why I had the union steward to be one of the members of the team when we took the surveys out. It was just so interesting to hear people talk and to be impressed by the questions on the survey. As always, you know, money is always an issue. Salary and benefits are always a concern. And that was our lowest percentage, was salary and benefits. One of the things that we did was we felt like people didn't know what all benefits they got. And once we started pulling the benefits together, we had an entire page of benefits. And we took that page, we now provide that to new employees so they know what they're getting. We gave it out to employees that had been here to kind of let them know what benefits they actually have. They really didn't know what benefits they had. This also helped us in relation to management. To me, there are modes. There's a staff mode and a management mode. And staff mode is that we mode, is that me mode. Management mode is that we mode. So getting management staff to understand it's not me. I've worked on the floor and I've worked sometimes with the team of nurses, but when I get into my management mode, my we mode, then it's for all of us. So I've got to accept, it's not personal, it's nothing against me. I've got to accept whatever this survey provides so that I can help all of us do better and all of us make this a great place to work and all of us provide quality care to the patients. So it was a learning experience all the way around for all of us. I'm looking forward to us doing it again. I don't know that we will do it electronic. We will kind of decide that. And we have some newer staff members, some younger staff members. We've even had some people that after the survey, and I guess they saw some of the changes or some of the managers told them about some of the changes. I had a couple of them come to me and say that they were going to resign, but they decided to stay. So, it's just great to have this opportunity, and DRCHSD gave us a chance to do something that we were going to do at some point in the future, but we were able to do it now. So, we weren't experts at this. We kind of felt our way through it. And that's what we came up with, and it worked out great for us. So I'm sure it can work out great for, you all that want to do it. And you can, DRCHSD has just been so great. You can kind of make it what you want it, because they didn't tell us, well, no, don't do paper and that's not going to work. They worked with us when we said we wanted to do paper. We just kind of did the steps and set up our process, but they really were instrumental in helping us and getting us on the right track to get that done. Thank you very much for listening.
Thanks, Marcia. Yeah, so that the most important thing to really a big factor in people participating in this is just trusting in the results being confidential and being listened to. And so you had some concerns, Marcia, early on about, are people really going to trust this process? And so doing what you needed to do with your people, your organization. And so doing what you needed to do just to make sure people had faith in the process. Your attention to detail, and that was, we were all kind of blown away by it. And for other organizations, it may be different. The paper thing may not be what's needed, but just really messaging about the confidentiality, having a third party administer it electronically really goes a long way very often toward that confidentiality piece. So there's a lot of different ways to do it, but it really is so important to have employees have faith in the process. And like I said, sometimes that first year, not all of them do, but very often by the third year, that response rate goes up. And I'm really interested to see what happens to the response rate at Greene County.
I am too. We're excited.
Thanks, Marcia. So we've got some time for questions, comments. Does anybody have questions for Marcia, for anybody else on the call who's gone through an engagement assessment? For me, for Patricia, anybody else on the Delta team?
And
Chase, I see you unmuted yourself. Do you have a question?
I'm sorry. Yes, thank you. We recently did an employee engagement survey and it wasn't this one. So I wanted to ask, is there a place at the beginning of your survey where you ask things like, what department do you work in? Are you male or female? What's your age range? Those sort of questions. Does this survey ask those questions?
We don't ask demographic questions. So we don't ask about age range, about gender. We have done, I see Jennifer Barber's here. So we have asked about departments so that we can break it down. That has become pretty labor intensive because of the manual data analysis required. So that's something that we have been moving away from. So yeah, we try to keep it as broad as possible. Again, in part because of the trying to keep things as clearly confidential as we can. With smaller hospitals, or departments tend to have smaller numbers of people, and so those sample sizes can really be a concern, confidentiality wise, as well as data integrity.
Yeah, that's some of the feedback I got was we do have small departments that may have anywhere from, some departments have one, and so I guess the concern was, yes, it's confidential, but if there's one male that works in the radiology department, for example, and, that kind of goes ahead and says, okay, we know who this person was. And so I do understand the benefit of being able to kind of hone in on if there's issues and, hey, we need to focus on this specific department. It's maybe having issues with, respect for coworkers or something along those lines. But at the same time, I feel like it almost prompts employees to be dishonest if they don't want to be identified. And one thing that I heard an employee say was, I'm going to put that I work in this department when I really don't work in that department because I don't want to be identified. And so some of those things, I just wondered about the survey that you guys administered because I was a little concerned about those issues. So
yeah, we totally understand those concerns. And really, what often comes out of this, so some of the things that usually take place afterwards. So we have the organization-wide picture. Here's where we are as an organization. And then often part of the process is for senior leaders to just go around and meet with different departments and say, hey, here's the results, here are some of the highlights, here's what we're thinking about doing, but I want to have a conversation with you. And so sometimes in those conversations, different issues that might be specific to one department may come out. And that to us feels like a better way to learn about those than trying to narrow it down to small departments and figure out, who said what, but just to keep the conversation, because the conversations are really some of the most important things that come out of this.
Yeah, this is Marcia. We have small departments too. We had like 89 employees at the time that we had this survey. We have about 102 now, but it wasn't department specific. So you're not going to get something to say environmental services says this and nutritional services says that. You're going to get something that says average ratings for questions about motivation to engage. I like the type of work that I do. I'm willing to work hard to help this organization. That sort of thing. That's what you're going to get back. And to me, that's what helped us. So it's all of us are in this. It's not like it's your fault because your male employee did so-and-so or said so-and-so. So you're not going to get that kind of information back. And the employees were happy that we didn't. The managers were as well, because that made them feel more confident in doing another survey.
This is Loretta. Dr. Pugh, and Shannon, whoever can answer this, and I may have missed this at all. I may have missed it. After doing the assessment, have you all gotten the results that has been shared with your staff, or will you be getting those results to be shared with your staff? And then after you get those results, then what's your next step?
Okay, this is Marcia. We did get those results. We have management meetings once a year. Once a week on Monday mornings. And like I said, I started out making rounds once a day. From the survey, I started making rounds twice a day and coming in early on some days to get night shift. The information that you get is really structured so that you can use it to make your changes or change your policies or whatever. So DRCHSD kind of guides you through that. We had a meeting, they went through everything with us. They showed us the good, the bad, the ugly, the great things. We had some really fantastic things that we're doing good. And we had a few things that we need to work on. Salaries and benefits was one of those. And one of the ways that we addressed that was pulling all the benefits together and making people realize just what they had in relation to benefits for the organization. We're looking to make some changes to salary, but it's hard to meet salaries for travelers, especially travel nurses, when you've got travel nurses making $75, $80 an hour. That's just unheard of in this area. So, we went the benefits route. We've talked to employees. We also let them know the benefits of being here instead of traveling someplace else. One of the things that travelers that I had talked to hadn't thought about was working for an organization. You have retirement. We have state retirement. We also take your insurance and taxes out, which is something you have to do when you're traveling. They don't take that out for you. So you're responsible for your taxes. So if you do good at the end of the year, it's your fault. If you do bad, it's your fault. But, just little things that the survey helped us figure out. And, as we went along, but the survey results were great.
Thanks, Marcia. I would add to that Laura, there's a couple of different avenues that different hospitals choose for communicating. Sometimes it's what Marcia said, which is really going around and talking to people and really sharing information. There's also Patricia often gets asked just to put together a one-pager. So just a quick communication tool to share with employees. So here are the highlights. Here are the things we did well as a hospital. Here are the things we really want to zero in on in the next year. And here's what we're going to do about it, so that employees can see it, or every supervisor can have it, so that everybody's going to speak in the same language when they're sharing results. Some hospitals have just asked for the slides, all the slides from the review meeting, and have used it in a town hall meeting to share kind of verbatim the big picture results. And then, as I said, a lot of hospitals choose to have the CEO and other members of the senior leadership team just go around to departments, like a town hall, mini town hall on the road. So going around just to meet people where they are in their department during the shift that they're there, and to say, here's what came out of it, and here's what we'd like to do, and we want your input before we finalize our plan. So there's a couple of different avenues, but the Delta team can support, whatever communication avenues you choose to go with.
Thank you, ladies.
Yeah, great questions. I wanted to make sure you all saw the question from Mr. Kramer that came in the chat as well. And he's asking that without naming names, describe the place you've seen that was the most difficult initial project.
when you say difficult project, do you mean just because the logistics of it were complex, or the culture of the organization was a difficult one? You can chat or unmute yourself. The culture. Okay. Such a good question. One of the more difficult hospitals I can think of, Patricia, I can't remember if you were on the team at the time, had really had many, many years of turmoil and turnover in the senior leadership team, and talking about trust, a lot of distrust of the senior leadership team. And so those kind of situations need to be handled delicately and realistically. So we knew people would be really skeptical about the assessment. And kind of as a group with the leadership team at the hospital just decided, we need to just have really realistic expectations about response rates. And they were indeed low. Some of the main themes that came out of it were concerns for negative consequences when employees speak up, when employees ask questions. People kind of get put in the doghouse or sometimes terminated. So there were a lot of really dysfunctional elements of culture that came out in it, and so that it was a hard conversation. And parts of it were expected, and parts of it were unexpected. And so in situations like that, it just requires really zeroing in on what's most important. What we always say is this is a snapshot in time. This is where people are at the time they're taking this assessment. And this is feedback that you get to decide what you want to act on and what you want to set aside for now. And so we spent a lot of time with that team sorting out what was most important to them, what they really felt was the most important to address. And that trust in leaders and feeling free to speak up was what they chose as their biggest one. And so that's not a quick, we're just going to put this in place in a week and everything's going to be fixed. So they know that was a long-term solution. And the team has been supporting them in that process since then. They're not into year 3 yet, so we don't know what the results will be, but that was probably the most difficult one.
May I chime in on that one?
Please.
Yeah, there was one hospital that comes to mind when I saw the question, and that particular hospital had a history of senior leadership not working as a team. There's a lot of finger pointing and blaming of each other. And so when they did the assessment, they tended to go in that direction. They wanted to blame each other and spend a lot of time not working toward a group consensus on how they wanted to prioritize change. They couldn't seem to bring themselves to work as a team. And so that required a lot of extra work on Shannon's part to get them to think what their priorities were as a team and to not finger point. So that was a very exciting presentation that Shannon did that I was able to observe, and it really was quite exciting to watch the leadership team attempt to move as a group or a team and get the first feelings of what that felt like.
This is Loretta again. I wanted to ask Dr. Pugh this question, but I didn't know if I was kind of, getting way out there. Because hearing that conversation just then, how involved was your board in your assessment? Because a lot of times when you have a lot of chaotic or a lot of mistrust, distrust, just things just going haywire, sometimes your leadership is contingent on how well your board supports what you do. And so I didn't want to get out there, but now that the conversation has come up, I just wanted to know, you know, if, you know, I know you shared it with your board. I just wanted to know the impact that, or the need that they saw and how important it was for what you put in place.
Okay, you're talking about the results?
Yeah, you know, the results and how important it was for you to ensure that the staff knew the structure of what was being presented to them and how well this was going to help you move forward as an entity to ensure the overall wealth and health and wellness of the community that you're serving.
Yeah, the board was aware. They were aware of the grant. They were aware of what the grant could provide, and they were aware of this employee assessment. They really were not involved in any of the questions, involved with setting it up or doing anything of that nature. They were also informed of the results, but I don't know that they saw what you're talking about. They saw that it was something that was done, it was good, but they—
And that's what I want to know. They saw it
Yeah.
was something you needed and it was something that was good. That's
Yeah.
it. That's all.
These are such good questions. One thing that's coming to mind as I hear you, Loretta, talk, and like as well, is as a senior leadership team, and I think Marcia, I think you kind of hinted at this a little bit. You put yourself in a vulnerable position by doing this, because you know you're going to hear some things that are hard to hear, but you will also hear some positive surprises as well. And so we get that for sure, and really are here to support you through that process. So we try to stay away from comparing hospital against hospital. It's really about, what are your results? Where are you trying to get as an organization? And what do those results tell you about that? Or what in the results do you feel good about, that you think, okay, we're on the right track with this, and this is going to help us with our mission and our goals for the next several years? And what could get in the way, and what do we want to do about it? So this is not okay, we're going to rank the cohort by score, and we're going to tell you all where you stand. This is really, it's so individual, and we get how difficult it can be sometimes. And we're here to support you through that process, not to make it boy, this is where you are compared to everybody else. You guys really better get your act together. This is about us supporting you and getting the results that you want.
You know, and that's why I was saying before, it's nothing personal. Everybody has to understand this is for the good of the organization. Nobody's going to pick on your department. Nobody's going to say that you don't have good management skills. It's not about that at all. It's about everybody putting this information together, DRCHSD compiling it, and we can look at it and say, this is what the majority feels, or this is what our staff feel, or whatever. But we can use that to move forward. Some things are a surprise. You know, we had something that was a surprise for us. Some things, well, yeah, we kind of figured that was going to be there. But it's nothing personal at all. It's just all for the organization, and to make everything better and make everybody's work lives better.
Right.
We've gotten some good feedback in the chat as well. Really, and now, you know, just really promoting how important that leadership is, and it really is a top-down. That was Chase's comment there. It's a top-down process, and if there's disunity in the leadership, then that's likely what you'll get throughout the system.
Absolutely.
Yeah. And then Doug Tanner writes there, a challenge that they've encountered is a long time department managers who are passive in promoting culture change initiatives inside their departments. The most logical response in these types of situations is to make a leadership change in that department. However, in some cases, the manager is the only one of his or her professional technical kind in the department. Subsequently making a leadership change requires either demoting the suboptimal manager and trying to hire another manager with the same professional credentials, therefore increasing salary expense in that department, or terminating the suboptimal manager and trying to hire another manager with the same professional credentials.
For sure. And we could have more than another 1 hour webinar on that very topic. So what I would say to that, just in the very short term in the soundbite, is yes, it's a really tough conundrum. And sometimes it's worth it's important enough to remove somebody who is going to create a really unhealthy culture. Even though in the short run, it's incredibly difficult and expensive, but in the long run, it benefits everybody and gets you to where you want to go.
Yeah.
Laura, I see your question about leadership training. Yes, absolutely. Yes, leadership training comes directly out of this based on the priorities that your leadership team decides you want to focus on.
Yeah, absolutely. Great questions. And I know we're right at the top of the time. I definitely don't want to cut anybody off, but I know folks will have to start dropping. If you're able to stick around for a few moments, I'm sure Shannon, Patricia would love to entertain any other questions. But I do want to pop up those post-polling questions so we can get those completed. And if there's any other further dialogue, we can continue that for sure. We really do appreciate just this webinar, the transparency, the conversation, and obviously the content experts here, Shannon, and then Dr. Pugh sharing her experiences as well, and many of you and many others. We appreciate that greatly. So again, I'll stop talking, let anybody else want to talk or type, and if you have to jump off, then we completely understand that as well.
I have a quick comment. I have a list of hospitals that have indicated that they would like an assessment or a reassessment. And I just want to let you know that I will be reaching out to you shortly.
Great. Thanks, everybody. If you want to stick around, we'll be here for a little while, but if you have to go, it's great to see you.
Yes, we thank you all. Great job, ladies. Appreciate you very much. Looks like most folks are jumping off, but thank you. Great presentation, great interaction there. So
Thank you,
for
Dr.
having me.
Pugh.
That's sure.
yeah, we'll
Thank you
see
so
y'all
much.
next time.
Thank you so much. Bye-bye.
Bye-bye.
Bye.